Hello everyone. So today we will talk about national exit test. Yes, this is NExT. Every MBBS doctor is talking about NExT because NExT will change the pattern of examination, the pattern of passing MBBS, and it will replace NEETPG as well. The national exit test would be conducted in two phases, step 1 and step 2. So today we will look uh, in the detail about national exit test. So agenda for today's seminar are the introduction, outline of the examination, general information about the NExT timeline, and the summary. So coming to the introduction. So as we know, the national test shall form the basis for certifying the eligibility for the medical graduate. So that means if you want to practice medicine in India, you have to pass NExT examination. So after passing step 1, you would be assigned for the compulsory rotational internship program. And the second thing is the foreign medical graduate also. They also have to pass NExT step 1 in order to practice medicine or modern medicine system in India. And the third thing is to determine the eligibility and ranking for the postgraduate medical education as well. So the applicability of the NExT would be on all the undergraduate medical students pursuing the degree of MBBS in all medical colleges. The second is the all the foreign medical graduates approved by the National Medical Commission as well. They also have to undergo NExT. The third, utilizing the result of the NExT for the purpose of admission to postgraduate courses in the broad medical specialties. So these are the applicability of the NExT. So all these things, MBBS, all the existing MBBS students, the foreign medical graduates, and the third thing is the purpose of admission to the postgraduate courses in the broad medical specialties as well. Now, what is the outline of the NExT examination? So it would be conducted in two steps. One is the NExT step 1 and the second is NExT step 2. NExT step 1, it would be a theoretical examination. These uh, theoretical examinations would contain one or more than one type of the multiple choice questions. It would be a computer based examination uh, which would be conducted in online modes. There shall be a centralized common all India examinations to be conducted by an authority, body or authority for the purpose by the commission. The second thing is the examination shall consist of the 6 papers covering subject of MBBS final part 1 and MBBS final part 2. So that would include medicine and allied disciplines, surgery and allied disciplines, obstetrics and gynecology, pediatrics, ENT and ophthalmology. Applied aspect of all the subjects covered under MBBS part 1, under MBBS first year and the second year, MBBS second year. Applied aspects of all subject covered under uh, final part 1 and final part 2. So that means this allied disciplines means the medicine and the allied subject like physiology, biochemistry, pathology, pharmacology, forensic medicine, PSM, all those things. Okay, so the weightage of all the subjects would be there in percentage wise, that we will see further. All those students who have completed the final part 1 or final part 2 MBBS course from a medical college eligible to appear in the examination. There shall be a regular NExT step 1 examination that would be held once a year prior to the university practical examination for the final MBBS, preceding compulsory rotating internship. That is important here because in existing practice, the after passing final part 2 MBBS, you would be assigning the compulsory rotating internship. But after that, the prior to the university practical examination for the final part 2, there would be a step 1 of NExT. Okay, our next step 1 supplementary examination shall be held once a year and is restricted to only those candidates who have failed in one or more of the 6 papers and are required to repeat those particular papers or subject. Okay, so if somebody fails, अगर कोई फेल हो जाता है एक पर्टिकुलर सब्जेक्ट में या एक से ज्यादा सब्जेक्ट में, दैट इज मैक्सिमम 3 सब्जेक्ट, तो उसके लिए एक सप्लीमेंट्री एग्जामिनेशन भी होगा जो कि एक साल में एक बार होगा. तो एक रेगुलर नेक्स्ट स्टेप 1 एंड एक स्टेप 1 सप्लीमेंट्री एग्जामिनेशन. ओके, those who do not pass both the next step 1 regular and the supplementary examination of a particular year shall be able to appear for the next step 1 regular examination only in the following year. जो आने वाले साल की रेगुलर स्टेप 1 नेक्स्ट होगा उसके उसमें उसको अपियर होना होगा. There is no restriction to the number of the attempts to appear in next step 1 provided the candidate has passed both next 1 step and next step 2 examination within 10 years of joining the MBBS course. तो अभी 10 साल में MBBS कोर्स ज्वाइन करने के 10 साल के अंदर MBBS को पास करना कंपलसरी होगा. However, there is no restriction to the number of the attempts. There is no restriction to number of attempts to appear in the next 1 step regular examination to improve scores, provided these examinations for the improvement of scores are taken at least after 1 year of completion of next step 2. So if somebody want to improve their scores in order to get into the postgraduate course, there is no restriction to the number of the attempts. Okay, then next thing is coming to the step 1, next step 2. So there is step 1, now step 2. The next step 2 shall be a practical, clinical or biobabosy examination covering 7 clinical subjects. So that would be medicine and allied disciplines, surgery and allied discipline, obstetrics and gynecology, pediatrics, ENT, ophthalmology and orthopedics and PMR. Next step 2, the examination shall be objective, structured, clinical case based, simulated cases, patient aimed at evaluating practical and clinical skills, clinical decision making and communication skill expected of an Indian medical graduates. Okay, the examination shall be held in person, live, and shall be conducted by respective state health university or institution. There shall be a regular next step 2 examination once a year. Okay, so step 2 is just like our university examination. That is we जो अभी होता है, that would be the step 2 of the next, that would be conducted by the health universities or the institutions. The next step 2 supplementary examination shall be held once a year and is restricted to only those candidates who have failed in one or more subject of the 7 subject and are required to repeat particular subject. Those who do not pass both the next step 2 regular and the supplementary examination of a particular year shall be able to appear for the next step 2 regular examination only in the following year. Okay, there is no restriction to the number of the attempts to appear in the next step 2, provided the candidate has passed both next step 1 and step 2 examination within 10 years of joining the MBBS course. So 10 years is the upper limit. Next score. Now how the scoring would be done? The marks in the next step 1 shall be calculated as whole number, which shall serve as the raw scores. Next step 2 examination result shall be declared as only pass or fail based on the acquisition of the appropriate competence that is being evaluated. Okay, so next one would be the raw marks and next two would be just fail or pass. Okay, so the minimum marks for passing shall be 50%, 50 out of 100, or half of the maximum possible raw for next step 1. For the next step 1, in each of the 6 papers, a minimum of 50%, half of the maximum possible raw score should be scored to pass the examination. The criteria for passing is next step 2 shall be satisfactory demonstration having acquired the competencies that are evaluated. That shall be declared as pass or fail result. So there won't be any scoring in next step 2. This would be just fail or pass. The total marks for the purpose of determining merit, especially for admission to broad specialty postgraduate courses, shall be calculated from the sum of raw scores obtained in each paper subject. In case of failure in one or more subject, the total marks percentage of next step 1 for a candidate shall be calculated from the sum of the total of raw scores in each subject paper obtained in both regular and supplementary examination in which the candidate has secured pass marks. The total marks percentage of those candidates who have appeared in next step examination to improve their score shall be calculated from the average, a mean of the last 3 consecutive years. Okay, for the purpose of determining merit, especially for admission to broad specialty postgraduate course, the next step 1 score shall remain valid for 3 years. Now, what is the utility for the next scores? The eligibility for provisional registration in an appropriate body to practice modern medicine as an intern and eligible to pursue internship. The eligibility for grant of license to practice modern system of medicine in India, that is for the foreign medical graduates. Eligibility for admission to postgraduate medical courses in broad specialty. Now coming to the information for the step 1. Objective of the next step 1, distribution for of items and knowledge level of question. So MCQ, this is basically the how the MCQ would be made, and what should be the breakup of the MCQ. Like the problem solving and analytical skill type MCQ would be around 65% of the of of the total papers. The comprehension type would be 25%, and recall type would be only 10%. So this is the pattern of MCQ that would be asked. Now coming to the paper and the distribution of the subject. So the medicine, the weightage would be 120 item and the duration would be 3 hours. Surgery and allied subjects 120 item 3 hours. Ops gynae 120 item 3 hours. Pediatrics, ENT and ophthalmology 60 items each, and the time would be 1.5 hours. So this is the proposed time schedule for the papers. Medicine Allied Sciences 3 hours. There would be a break of 2 hours, and again the pediatrics paper 1.5 hours. So the 3 days and 6 papers, 2-hour breaks between the papers. Okay. So now coming to the step 2, the information regarding next step 2. The next step 2 shall be a comprehensive practical clinical examination to be conducted after completion of internship that evaluated competencies in clinical diagnosis, patient and clinical decision making, practical and communication skills necessary for practice of modern system of medicine, especially in India. Okay, so step 2 would be just like the university examination that is currently in practice. Now the evaluation method for the step 2. So that would be actual cases, the objective structured clinical examination, the simulation if possible. Depending on the availability of the satisfactory performance or unsatisfactory performance, there shall be only 2 level of grading: competent, that is pass; not competent, that is fail. Now distribution of the subjects. The following subjects shall be evaluated during next step 2: medicine and allied subject, surgery and allied subject, obs gynec, pedia, ENT, ophthalmology, and the orthopedics and PMR. That is for step 2. Now coming to the information regarding next step 2. So the time schedule. Next step 1, that is regular, second week of December, and date of result second week of January. Next step 1, supplementary. The next thing is the final part 2, practical clinical university examination, first week of January and fourth week of January the result would be declared. Internship 1st Feb to 28th Feb of the following year. Next step 2, second week of March. Okay, so December is the next step 1 regular examination, and next 2 regular second week of March, and the first week of April the result will be declared. Next step 2, supplementary, after 6 months, postgraduate admission May June, and the result would be declared on 30th June. The postgraduate course shall start from 1st July. Okay, so coming to the summary of this whole pattern of examination. So the whole uh, examination, it would be conducted in two phases, that is next step 1 and next step 2. Next step 1 is just like NEETPG that is being done these days, and next step 2 is just like our university examination. Next step 1, it would be applicable for all the undergoing MBBS students. One thing. Second thing is the all foreign medical graduates, and third thing, the marks would be utilized for admission to the broad specialty postgraduate courses, right? Okay, thank you so much.